The FDA is expected to give its emergency approval of Pfizer's COVID-19 vaccine as soon as tonight. That's according to the New York Times.
But polls show people have questions and concerns about coronavirus shots. 9 on your side's Ariana Kraft begins our team coverage live in Greenville tonight. Ariana, what are people saying about the vaccine?
Ken, Angie, there's a lot of information on the different COVID-19 vaccines, and it can be overwhelming for people. Some people I heard from today say they just don't know enough about the shots.
We're listening and hearing where that's coming from.
And one thing health experts are hearing is why many people don't want the vaccine.
I don't really know much about it, particularly technically.
Dakota Alex says there's a lack of trust.
It's not that I'm an anti-vaxxer, but I'm more anti-big corporation, anti-pharmaceutical, and that's really, I think, my big resistance to it personally.
North Carolina Health Secretary Mandy Cohen knows people are wary of the shots, and that's why medical officials want to share everything they can about the vaccine.
We are going to need, I think, a federal framework for how we're all talking about this together, because there's a lot of details here, and I think it's going to be really important that we're all singing off the same sheet of music, if you will.
The vaccine safety is one of those details.
The safety data looks really good. All of the side effects, if you will, that we're seeing are those we see with any vaccine, both in studies and in clinical practice. There's been nothing that's been unexpected.
Experts also want people to know how the vaccine works.
There is no COVID-19 virus in the actual vaccine themselves. The vaccine imitates the infection so that our body thinks a germ like the virus is attacking, and this creates the antibody defense we need to fight off COVID-19 if and when the real germ attacks.
Doctors also say ending North Carolina's restrictions
I want to see stuff open back up.
Depends on people getting the vaccine.
We know that it takes all of us. We're all in this together. And so participating in clinical trials and also getting the vaccine is really important.
Oh, yeah, I think I'll take it. Yeah, I think it'd be good for people. You know, it'll help the situation.
Officials say North Carolina is getting a limited supply of vaccines, which will first go to people at highest risk of the virus. They say that means wearing masks, social distancing, and getting tested for COVID are still musts. Live in Greenville, Ariana Kraft, 9 on your side.
Ariana, thanks.